Hi, everyone. My name is Kyle Irvan. I'm an instructional systems designer here at Appian, and I'm going to talk to you today about 5 low-code use cases that you should know about. When we are asked, what does Appian's low-code platform do, the simplest answer to give is that it does just about anything. Unfortunately, that's not a very useful answer to receive, and so today we've decided to share with you these 5 use cases so that you can get an idea of how other businesses have solved their problems using Appian's low-code platform. The first case we'll look at is how a utilities company was able to meet their ESG targets using Appian. And then we'll look at 4 cases in response to COVID, 1 in education, 1 in food service, 1 in healthcare, and 1 in lending. So let's look at how a utility company in the UK was able to meet their ESG targets. First off, what is ESG? If you're unfamiliar, ESG refers to a broad range of environmental, social, and governance criteria on which companies can be measured. These can include greenhouse gas emissions, workplace diversity, as well as transparency and reporting practices. It's of increasing interest to investors to make sure that the companies in which they are investing are pursuing strategies to be sustainable in the long term. As a result, ESG metrics are changing the way companies do business around the world. Market pressures ensure that utilities, just like other companies, are pressured into pursuing innovation and risk management in their long-term strategies. Anglian Water is the largest water and water recycling provider in England and Wales by geographical area. They cover over 27,500 square kilometers and supply 1.2 billion liters of water to their 6 million customers every day. To continue meeting the region's growing demand for environmentally friendly clean water, Anglian is investing in the next 5 years in several capital projects such as smart meters, new pipeline, and new pumping stations. And they needed a way to increase their efficiency and speed in the management of these processes, as well as mitigate risks. Anglian's existing practices could not keep up with what they were trying to do. First off, their decisions were often being made based on monthly reports that were compiled manually from data that resided in many underlying systems. This data had to be collected manually, compiled manually, and communicated manually, which meant that Anglian was sometimes making decisions based on data that was up to a month old. To address their needs, Anglian built Totex Delivery Workflow, a low-code solution that provides key advantages over their previous methods. First, it gives employees a single and intuitive view of all the data they need to do their job well, regardless of where that data lies in their underlying systems. Metrics, KPIs, and reporting are now available in real time, removing the lag that hampered their previous system. It's led to a simpler experience for Anglian employees who now have just one place to go for all of the information they need. It's also led to a better visibility for managers into the status of their capital projects and better visibility for regulators who are keeping track to make sure that Anglian is meeting their ESG targets. COVID, as we all know, has impacted businesses in every sector. Demand for some products skyrocketed overnight. Demand for others collapsed in the same period. On top of that, employees were potentially at risk of contracting or spreading a deadly virus to their coworkers. Businesses needed a way to stay flexible and to make smart changes fast. We're going to look today at 4 such businesses, 1 in education, 1 in food service, 1 in healthcare, and 1 in lending. So, COVID and education. School closures are a big deal. I'm sure everybody here who is a parent, and many who aren't, have their own personal library of stories to tell about what it meant to have their kids home with them for as long as they did. But it wasn't just families. Educators also obviously had to adapt. Our education system was forced to very rapidly switch from in-person instruction to remote learning, many for the first time. COVID put our education technology infrastructure to the test and found it in many ways lacking. Poor internet connections, students without laptops, teachers that did not have familiarity with the video conferencing tools we're also comfortable with now. In response to the ongoing hardships from the pandemic, Congress passed legislation to address a wide variety of needs, including in education. Specifically, the American Rescue Plan included billions of dollars to help school districts adapt. One program that was part of the plan provided funding for schools so that they could request that funding to buy laptops for their students. The problem was there was no process in place to apply for this funding or to manage those applications or to distribute the funds. With Appian's low-code platform, the organization that was responsible for handling these requests was able to, in a matter of weeks, stand up a solution that managed the entire application process, from intake to award and through closeout. It also had comprehensive monitoring to ensure that everything was done up to the standards of the US regulations. The application allowed for roughly 90,000 users to request funding to buy laptops for their students, and ultimately, roughly $6 billion was allocated through this program. And again, thanks to the power of low-code, they were able to stand this up in under 8 weeks, which minimized the impact to learners. Now let's take a look at how COVID has impacted the food service industry and how people have adapted there. Food service was massively impacted by COVID. Restaurants were forced to limit their capacity or close entirely. Jobs were lost, some companies had to close down, and the others had to find a way to stay afloat. DC Central Kitchen provides foods for low-income residents in the DC area. They take donations of recycled food, that is food that would otherwise be thrown away, and use that to create healthy meals for low-income residents. And I want to talk to you today about 2 programs that are run out of DC Central Kitchen: Community Meals and Healthy Corners. The Community Meals program is one where DC Central Kitchen prepares on-site a number of meals that are then delivered to various community centers in the area. Those could be homeless shelters, rehabilitation clinics, schools, and the like, where it is then distributed to people who can get otherwise unaffordable food. The Healthy Corners program partners DC Central Kitchen with local corner stores so that they can purchase from DC Central Kitchen fresh produce that they can then sell to their customers in areas where fresh produce is often hard to come by. Both of these programs faced challenges due to COVID. Historically, the Community Meals program provided their meals family style or buffet style, which resulted in a lot of people in relatively close quarters. And they needed, in order to promote social distancing, to change their processes to adapt and package their food in more individual portions. The Healthy Corners program relied on a number of handwritten forms that were often just passed from one person to another, face-to-face, and DC Central Kitchen wanted to find a way to make these interactions touch-free. In addition, they needed to make sure that the workers who were preparing the food and delivering the food were themselves not exposing vulnerable populations to unnecessary risk of the virus. With Appian's low-code platform, DC Central Kitchen was able to adapt quickly to the changes they needed to make. Much of the work that had previously been done in handwritten forms and in spreadsheets could now be done online. Stores participating in the Healthy Corners initiative were able to complete their requests for produce online as opposed to through paper forms, and those orders were then put directly into an order management process which tracked the orders from submission down through delivery. The process by which they managed their Community Meals program was also easy to adapt thanks to Appian's low-code platform. They were able to very quickly change their processes to account for the purchasing of new supplies for individual portions and individual packaging of their meals. In addition, worker health and exposure risk could be monitored through the workforce safety application. And in addition to these COVID-specific applications, DC Central Kitchen was able to synchronize their menus across all of their different programs. In the past, each program was sort of siloed off from one another, and if they got a donation of a large amount of some new food, one program might know about it, the others might not. And now all that information is shared in real time so that everybody's up to date. Perhaps no industry was hit harder by the pandemic initially than that of healthcare. Around the globe, healthcare providers faced a number of challenges as the number of cases grew and grew. Hospital workers were running out of critical PPE, masks, and other equipment. Life-saving devices such as ventilators were hard to come by, in some places completely unavailable. Providers needed a way to keep their healthcare providers and their patients safe from exposure to the virus. With an unprecedented number of people in need of acute care, many providers found themselves in a position where they were forced to discharge some patients earlier than they might otherwise have had to. They needed to free up beds to take in new patients. What about these patients who were being discharged? Where were they going? Some were being discharged to home. Some were being discharged to other care facilities like a group home or a nursing home. Some had continuing care that they needed. Some didn't. Some required follow-up visits. Others didn't. Providers needed a way to keep track of their discharged patients to make sure that everybody was receiving the care that they needed. On top of that, they needed to make sure that their own healthcare providers weren't getting their patients sick by spreading the virus from one to another. With Appian, one primary care network within the NHS was able to, in just 6 days, build an application that allowed them to track the discharge of 1.5 million patients. Discharges were categorized into one of several types based on where they were being discharged to and what sort of follow-up care they needed. An automated follow-up schedule lessened the amount of time that doctors had to spend in email and doing paperwork, which allowed them to spend more time with their critical patients, taking care of them. It also had the benefit of facilitating a patient-centric model of care. Because the various institutions that were participating with this app were all putting data, because the app could see into the data from these various institutions, providers could look at one patient's record and see all of the data for that patient, regardless of from which institution that data came. This means less bouncing forms back and forth, less emails from one provider to another, and approvals and all of that to get critical information on their patients. And to further help protect the health and safety of the providers and patients, the application also provided a unified command center for tracking the health of the workers as well as who was working where and when, so they could keep track of all the different healthcare workers throughout the network. Now let's take a look at how low-code helped some lenders address needs imposed by COVID. The pandemic brought financial hardship down on many people, leaving them unable, whether they were laid off or furloughed, to make payments, sometimes on their mortgage, which for most people is the single largest purchase they make ever. Governments around the world recognized this problem and stepped in to offer debt relief in some instances, delayed payments, or delayed interest. As a response, financial institutions who were holding these loans needed to process a large increase in the number of requests for such loan moratoria. There we go. Garza, founded over 40 years ago, is a provider of mortgage and asset management for the largest financial institutions in Spain. And they, like every other financial institution, received a large number of new requests for moratoria on loan payments. They recognized that their customers who were coming to them with these requests were often facing other hardships in addition to their financial hardship. Many were sick, or they knew somebody who was sick, or maybe they had lost somebody to the pandemic. They wanted to minimize the stress of filing for these moratoria, which can be very stressful. And so they wanted to have it as a process by which they could increase the number of requests they were handling while still keeping the customer experience high. With Appian, they were able to do just that. They were able to build an application that managed these requests for moratoria on loan payments, and they were able to increase the customer experience significantly by connecting all of the underlying financial institutions' data together so that customers didn't need to bounce from this financial institution to that financial institution. They could just go to this one app. And it also automated a lot of the communications, which means that once an application was approved or a request was granted, the requester could be notified immediately instead of needing to wait. This meant that people found out the status of the requests much quicker, which allowed them to either move on or to seek other ways to take care of their problems. So back to the original question. What does Appian's low-code platform do? Well, we've seen a couple of different examples, right? We've seen companies meeting their ESG targets. We've seen them adapt to radically increased requests. We've seen them manage the health and safety of their workforce. In general, Appian's low-code platform is best when companies are trying to solve problems related to slow manual processes, reducing human error, and connecting lots of data from different underlying systems and presenting it in a unified way. I want to quickly cover a few use cases that are from other sectors. In the financial sector, Appian's low-code has been used to address customer lifecycle management, governance and risk compliance, lending and payments, as well as onboarding services. In the automotive insurance industry, Appian has been used to support policy underwriting, property and casualty claim resolutions, as well as marketing and sales. And in government applications, Appian's low-code platform has supported use cases from organizational restructuring to source and vendor selection to managing requirements and compliance. So with those examples of how Appian has helped our customers in the past solve their business problems, how can you get started with Appian to solve your problems? To that end, Appian offers a number of different ways for you to learn either to get started with the platform or to build your existing skills. Appian Community at community.appian.com houses numerous discussions between Appian users about how they've addressed problems that they've had. Appian Academy offers courses to suit your needs dependent on your role. We have courses available for developers, as well as administrators, as well as analysts. There's different learning paths so that based on your role, you can get just the education that you need. We offer education online for free, or you can sign up for instructor-led training. We also have Appian Community Edition, which is a free instance of the Appian low-code platform that you can use to get started practicing your skills today. Specifically, the Appian Developer Learning Path on Appian Academy will walk you through from absolute beginner to building your first app in under 2 weeks with hands-on practical exercises. So, where should you go from here? If you need more examples or more context, you can visit our resource library on our website. You can also sign up for Appian Community at community.appian.com and get started with all of our learning options and all of the various tools that are available there. I want to say thank you so much. I hope you enjoyed this presentation, and I hope you enjoy the rest of the conference.